Thank you, Jessica. My name is Mark Carroll. Like Neil Cassell, I'm a neurosurgeon, and somehow we seem to be attracted to technology like focused ultrasound. I am the chair of the MITA Focused Ultrasound Working Group, and I'm going to talk to you a little bit about that now. I wanted to preface my conversation by giving you a case example of the kind of situation that we're encountering, and it really ties in the two talks that we had today and yesterday from AvaMed and CTA. My company, I'm CEO of Sonicare Medical, we are in the focused ultrasound treatment for prostate. It's a transrectal ultrasound or MRI guided ablation procedure. It's an outpatient procedure, hospital or ASC based, under general anesthesia. And we talked yesterday, we learned about how patients are receptive to the impact of treatment. If you look at the difference between focal HIFU, for instance, and prostatectomy radiation therapy for prostate cancer, the comparison is almost moot. It's a one-day procedure. You're back to work the next day. You're driving your car the next day. Frankly, you're having sex the next day. And this compares extremely favorably with prostatectomy and radiation therapy. The status of focused ultrasound internationally is that it's been CE marked or approved in more than 50 countries for ablation. It's been used to treat BPH and prostate cancer since 2000, with close to 60,000 patients that have been treated. And many countries have established payment systems. In the US, regulatory authorization was granted for prostate tissue ablation, a tool claim, just like a scalpel, in 2015, and about 3,000 patients have been treated since then. It can only be sold or marketed for tissue ablation. There's a C code which was granted in 2017, approximately 18 months after regulatory authorization, but there's no coverage decision, which means from a patient point of view, they don't know whether they're going to get paid or not. There's no formal commercial insurance coverage decisions except for salvage, and the majority of patients pay out of pocket. And when you look at the comparison from a clinical point of view, again, there is no comparison. On the disease control side, partial gland ablation with HIFU is equivalent to radical prostatectomy and radiation therapy over upwards of 11 years of follow-up. And there's essentially no incontinence and very little erectile dysfunction, which cannot be said for radiation therapy and prostatectomy. The insurance coverage savings to the healthcare system from having this technology used for all prostate cancer for which it is appropriate approaches $7 billion over 5 years. And on the patient side, there's a savings approaching $1 billion over 5 years. So the challenge to us in each of the areas that we're working in is how do we get this technology, which I think we all believe in strongly, and have data to support, how do we get it to be commonplace? MITA, the Medical Imaging Trade Association, has a vision of medical imaging driving effective patient care through screening, diagnosis, and treatment. And its mission statement is to reduce regulatory barriers, establish standards, and advocate for the medical imaging industry. Fortunately for us as therapists, MITA recognizes that focused ultrasound should fall under their domain because we are image-guided. And in fact, the reason why all of us are here and getting so successful, we saw the encouraging data on gynecological applications. I just presented the encouraging data on prostate applications. Imaging is driving everything that we do. It's made our technology possible in the clinic. MITA is the collective voice of medical imaging equipment manufacturers, innovators, and product developers. And they represent companies whose sales comprise more than 90% of the global market. Through an outreach on the part of the Focused Ultrasound Foundation to MITA, MITA made the decision to bring us into the fold, so to speak. Each one of these technologies that are listed here have a working group to which MITA devotes its resources, activities, and attention in order to achieve the objectives of each one of those groups. And sometimes those objectives differ, but in most cases they overlap, and that is getting these technologies into the hands of clinicians to be used on patients who do not have to pay for these technologies out of pocket. And focused ultrasound was added to this last year. This is the organizational structure. There's a board of directors, and you can see that there's sections and committees. We have been given a section, a working group, and have been assured that there is an effort underway to actually give us a seat at the board of directors table as representatives of the focused ultrasound, which means when meetings are held with payers, when meetings are held on the Hill, when meetings are held with interested third parties, we will have a seat at that table. There are a variety of different committees that exist within within MITA. Each one of these relates to various outreach activities, and as a focused ultrasound working group, MITA brings the activities of these various committees to our attention when we have our meetings to determine whether there are outreach efforts or objectives on our part that align with the committee efforts or can modify the committee efforts in order to achieve our specific goals. And obviously the ones that are of the greatest interest right now for us are reimbursement, coverage, and probably government relations, because we feel very strongly that getting government to realize the savings and the patient satisfaction levels that are achievable with this technology will help drive on the other side. Among the sections, as I mentioned, there's a focused ultrasound section. We have been formed to promote the values of this organization among not just this organization, but this organization, manufacturers, patients, providers, among policymakers, and to secure coverage and reimbursement. As I pointed out in my opening remarks, we have reimbursement for prostate, C-code, but we don't have coverage. So effectively, it causes more confusion than if we didn't have reimbursement, because patients, physicians, institutions don't know whether they're going to get paid or not. They don't like uncertainty, as you know, so they don't get involved. Our goals and objectives specifically within our working group are to develop a working relationship or a better working relationship with the FDA, with CMS, and with private payers, to establish relationships with professional societies. And in my opinion, this is probably our most challenging task because, as I'm sure many of you know, especially in the gynecology and bone fields, it is difficult to get the professional societies to recognize what we are doing because it challenges what is done traditionally. And without their endorsement and backing, it's very difficult to get especially commercial payers to approve our technologies and pay for it. If you've gone to commercial insurance coverage websites, they do extensive literature reviews of each of the technologies that they're looking at, of each of the clinical applications. And at the end of it, they always include what the professional societies say. And it's an easy fallback position for them, no matter how good the clinical data is. If the professional society has not sanctioned the technology or the application, it's easy for them to say no. We are working to develop and execute a PR campaign to raise the profile of focused ultrasound in general. We're actively in the process of organizing and hosting a Capitol Hill briefing, yes. In this day and age, we probably will be breaching, but to organize a Capitol Hill briefing and to develop a bipartisan team of congressional champions. Politics should not be an issue here. It's what's best for our patients. We have monthly calls as a section. We have biannual in-person meetings. Our semi-annual meeting is tomorrow morning. I encourage any of you who have an interest in hearing what we are about, to meeting some of the people involved, to meeting Patrick Hope, who is our direct liaison with MITA, to attend. It's from 7 to 8 o'clock tomorrow morning, and we're working to develop a social media campaign that focuses, for the most part, on patients. Patient testimonials, as I think we all know, is the best way to get to coverage and to our representatives in Congress. These are the names of the members of the organization currently. We'd love to add not just more companies, but at least from my point of view, institutions, advocacy groups that may work in conjunction with MITA, et cetera. So I encourage you to attend our meeting tomorrow morning, 7 to 8. And as Jessica said, we will be covering many of these specific issues tomorrow during some of the sessions. Thank you very much.
So you described very well what the insurance companies are doing. And my question is, there is a trend now for enterprises, companies to be self-insured rather than rely on payers. So for them, it should be a no-brainer to adopt focused ultrasound as a first-line therapy. So have you encountered any opposition there as well?
We have, on the prostate side, Papa John's, the Firemen's Association of America, I think the Railroad Associations of America, they all are self-funded and they have approved HIFU. We've had preliminary conversations with some of the major chains like Home Depot, Lowe's, et cetera, with initiating conversations along those lines. And we're finding some receptivity among the managed care organizations as well. Many of those, however, want to do pilot studies first. And I think that a pilot study, as was suggested this morning for Medicare, the concept of funding in order to allow patients to be treated, to acquire the data necessary to determine whether funding will continue, is a marvelous concept. I think that was proposed by AbMed this morning, and I think it's something that we really need to be advocates of. When a device is approved by the FDA, CMS, rather than farming out decisions to each of the individual MACs, should make a blanket coverage decision for a time period in order to get patients treated, to have the data so that a permanent decision can be made.
What about the VA? They are mandated by law.
Yeah. The VA has a separate set of issues. We as a company actually have our technology into 2 VAs, and the VA, for those of you who don't know, will send patients to wherever it is appropriate for them to get treated if their physicians believe it is appropriate. So if I'm a physician in Charlotte and I don't have a VA, but I believe that HIFU is appropriate for my patient and I want to send that patient to a private practice, they'll pay whatever that private practice charges. We have 2 VAs that we're actively working with. There are ways to get permanently in the VA system, but the VA also has some interesting requirements in terms of cybersecurity, in terms of sterilization, in terms of high-level disinfection with technologies that can get in the way of easily getting it in. Plus, it's dependent upon the VA's purchase cycle in order to acquire the technology. But they are promising. The other thing I'll mention, just because I know that a lot of people don't know this, and it may play in many of the technologies, especially like in gynecology where there are codes, the local MAC that pays is not your local MAC. It's the MAC where you're treated. So if a technology is approved by a MAC in California and you live on the East Coast and you send a patient to California and they're treated in California, that patient will get covered by California even though they're not covered in North Carolina. So it's something to remember as you send patients around the world. Any other questions? Yeah. Which press release? The one about the which? Yeah. So are we going to talk about that tomorrow at all? Not in the meeting in the morning, but do we have that on the agenda for tomorrow? So a press release went out this afternoon. Patrick, you want to summarize what that was? Because this is important for conversations here.
Yeah, I'm Patrick Hope. I'm the Executive Director of MITA. Thank you, Mark, for that. The President just signed an opioid package, which includes grants, provisions in there to test different ultrasound-guided technologies that will curb the use or the need to prescribe opioids. And so those grants will be available to hospitals and other facilities to try different innovative things. And we think this is a very good opportunity for Focus Ultrasound. MITA released, the president just signed it today, and MITA just released a statement praising that and encouraging Focus Ultrasound to take advantage of those grants.
All right, so if we think about the presentations that we've heard of the past several days, I can probably call at least a dozen where pain was referenced in the reason for the treatment, whether it was for gynecological applications, bone applications, spine applications, et cetera. Any of those applications potentially have a preferred path because of this law that's been signed. We will be discussing this and the impact it has on the Focused Ultrasound Foundation and many of our own individual efforts at the breakfast tomorrow morning. So if you're interested in that, it's another shout out to come to that breakfast 7 to 8 o'clock in the morning. Thank you.